The Scientific Center for Pediatrics and Pediatric Surgery is a unique multidisciplinary research and medical institution, as well as an educational base for the training of highly qualified personnel. The center, which is working to improve the health of mother and child, is 85 years old this year. By the decision of the government on November 28, in 1932, the Scientific Research Institute for the Protection of Maternity and Infancy was established. In 1934, a building for women's counseling and nurseries was allocated. Also, a measles vaccination center and a medical library were organized. In 1994, the name of Scientific Center was renamed to the Research Institute for the Protection of Maternity and Childhood. The staff employed 10 researchers and 72 highly qualified specialists. During the Great Patriotic War, the Institute's employees participated in the work of commissions on the reception and enrichment of evacuated children who had remained without parents, organized their meals, breast milk collection, opening of dairy kitchens and food station, provide methodological assistance in the work of social and legal office for women and children's consultations, dealt with the issues of adoption of wartime orphans, patronage and employment of adolescents, develop acceptable forms of childcare for schools at the time as well as preschool institutions and women in industrial enterprises. During the year of Virgin land development, the Institute's employees took a direct part in organizing and setting up work in children's daycare centers, district hospitals, maternity hospitals in the developed regions of the Republic. In 1959, a department for nursing preterm infants was opened for the first time in the medicine of Kazakhstan. In 1965, a group of scientific medical and medical technical informations was created. In 1972, the Governmental Research Institute for the Protection of Maternity and Infancy was renamed to the Scientific Research Institute of Pediatrics. For great achievements in the field of child health, the institute was awarded the Order of Friendship of Peoples on 6 January 1983. According to the Decree number 672 of the Council of Ministers of the Republic of Kazakhstan, the Institute of Pediatrics was transformed into the Scientific Center of Pediatric and Pediatric Surgery. Great attention was paid to the training of scientific personnel. The most important scientific works on pediatrics in pediatric surgery were written. Science 1993, 52 doctoral and 269 candidate dissertations have been defended. Science 1995, at the Scientific Center of Pediatrics and Pediatric Surgery, edited by the academician of the National Academy of Science of the Republic of Kazakhstan, or Mantayev Kamal Sarvarovich. The Republican Scientific and Practical Journal Pediatrics and Pediatric Surgery of Kazakhstan is published, which is the leading scientific and practical publication for a wide range of pediatricians. In 2002, according to the order of the Minister of Health of the Republic of Kazakhstan, the Scientific Center for Pediatrics and Pediatric Surgery was approved by the main methodical, scientific and practical and consultative center. Currently, the center has professional staff who have passed various internships in the best world clinics. More than 700 employees are selflessly working here, among them more than 140 doctors and 30 scientific employees, including 1 academician, 20 doctors of medical sciences, and 27 candidates of science. The main activities of the Scientific Center of Pediatrics and Pediatric Surgery are research activities, provision of highly specialized medical assistance to children, introduction of innovative technologies, organizational and methodical work, and the development of skills of doctors and scientific personnel. Nowadays, the clinic annually receives the necessary high-level medical care as close to the world standards as possible. It has more than 6,000 children from all regions of Kazakhstan. In the center there are 16 clinical departments where congenital malformations, blood diseases, malignant neoplasms, respiratory and digestive diseases, hereditary syndromes, primary immunodeficiencies and other severe diseases of childhood are treated according to international standards. The center is not only a medical institution but also a base for the training of experienced personnel. Here, residents are trained in the specialties pediatric and children's surgery, and work is also underway to upgrade the skills of regional specialists. We are pleased with the achievements of the Scientific Center of Pediatrics and Pediatric Surgery. For scientific works, the center was patented 110 times. 25 monographs were also published. More than 70 methodical works were presented in the center. The center was headed by people who made a tremendous contribution to children's health and training of medical personnel. Also, the specialists of the center are now working in various medical organizations and higher educational institutions in managerial positions. We are proud of the professionals of the Scientific Center for Pediatrics and Pediatric Surgery. Among them such professionals as pediatrics Tamara Kuravgalievna Chuvakova, Жанна Kokeshevna Sikenova, Rima Bazarbayeva, Zaurish Balahmetovna Kozhahmetova, and others. Professionals of their field are children's surgeons Majbayev Kuanish Abdikarimovich, Akhbarov Nurlan Nurkenovich, Aipov Rasulbek Rahman Berdievich, and others. Nowadays, the director of the Scientific Center of Pediatrics and Pediatric Surgery is Borambayeva Riza Zulkarnaevna. Today, the center is carrying out complex operations with progressive retinopathy of the newly born, together with the specialists of the Research Institute of Eye Diseases. Up to 300 laser operations per year on the retina and successfully carried out to prevent blindness of babies. Complex surgical operations in the developmental, anorectal, hepatobiliary and thoracic areas are successfully conducted. Minimally invasive video endoscopic interventions for urological and abdominal pathologies are used. There are operations to correct complex congenital malformations of the cardiovascular system in children using the apparatus of artificial circulation and minimally invasive endoscopic intervention. On average, more than 2,000 open heart operations and more than 400 endovascular operations are performed per year. Newborn children are provided with surgical care with congenital heart defects as well as congenital malformations. They are carried by two different departments. That is, at the moment, the provision of surgical care is very diverse. In our institute, we have an angiographic device, thanks to which endovascular surgery is performed for children with cardiosurgical pathology and children with arteriovenous malformations. By the way, those operations that are taking place in our institute for children with arteriovenous malformations are conducted only in our center in Kazakhstan. And now, since the onset of the oncohematology department of the center, more than 5,000 children with various oncological and hematological diseases aged 0 to 18 years have been examined and treated. In the Republic of Kazakhstan, since 2012, more than 70 hematopoietic stem cell transplantations have been performed for children with hemoblastosis and tumors. For the first time in Kazakhstan in 2016, together with Russian specialists, haploidentical transplantations of HST was successfully performed. Since 2012, new information technologies have been used extensively in the provision of medical care to children. telemedicine, which allows clinicians to conduct teleconferences with medical and preventive institutions in our country and foreign clinics. Specialists of the center remotely advise patients, conduct consultations of severe patients in the regions, and planned video lectures within the framework of programs for upgrading the skills of regional doctors. The Scientific Center of Pediatrics and Pediatric Surgery for today serves as the head multidiscipline pediatric organization where highly qualified specialists work. The center closely cooperates with the leading world clinics of Germany, Russia, Belarus, Ukraine, South Korea, etc. Specialists of the center have undergone training in the best foreign clinics and continue to cooperate with colleagues from foreign centers. The main perspective of our center is to reduce infant mortality rates in the country. Over the past 5 years, almost 2 times it was possible to reduce infant mortality. If in 2011 it was 40.9 promille, then for 8 months of 2017 it is 8.1. Of course, in the OECD countries this indicator is much lower, and therefore we have something to strive for, and all our work at the main Republican pediatric institution is aimed at improving the provision of medical care to children and reducing infant mortality. I think that by the jubilee of our center we came with good achievements. This is due to the fact that our center has existed for a long time and certain traditions have been developed. In our center not only young people work, but there are veterans of our service who have worked in our center for many years. I think that there is a continuity of generation and young people. There is someone to learn from. Our veterans, they are certainly very pleased that they have students and that their students continue their business. And without doubt, if we compare what the center was 80-85 years ago and what it is now, then a very big difference could be observed. And according to all the results, we see the infant mortality is declining. The Center of Pediatrics is 85 years old. This is the age of wisdom, a huge life and professional experience. Without the personal contribution of each specialist, we would not be able to achieve the results and the level of development of our center. Each employee is a professional in his field of supervised questions. We are a team of like-minded people who tirelessly strive forward to new victories in the formation of a healthy generation from the very first days of their birth until they entered into an independent and adult life.